Assalamualaikum and a very good morning to everyone. To Madam Raihan, this is group 9. We will be presenting about interpersonal counseling. My name is Nadia Alisa. We will be presenting about IPT. So IPT is the interpersonal counseling. I'll be saying IPT as interpersonal counseling for short. So, professional counselor, they apply a variety of concept, theory, and approaches in their work. Meaning that when you go to a counselor, they use different concepts, they use different theories. So one of the theory is IPT. Counseling approaches are based upon numerous theories that are interconnected with each other. So to become a professional counselor, you have to be verified. You have to know all the concept and theory. So it's not easy to become a professional counselor. The simple definition of interpersonal therapy, also known as IPT, is actually a method of treating depression. IPT is actually a form of psychotherapy. It mainly focuses entirely on your relationship with other people. That's the word inter. Inter means our relationship with other people, while intra means our relationship with ourselves. So inter is actually based from the word when you interact with other people. So IPT, it derived from the idea that personal relationships are the center of all psychological problems. IPT is just a form of psychotherapy. Thus, the effectiveness of IPT entirely depends on the client's level of mental health. Meaning, if a client seeks some personal input from the counselor himself or herself, the client's level of health needs to be regulated. Means before they seek the help, the counselor needs to monitor the level of depression of the client himself. Meaning, this treatment is based on the depression level of that someone that is doing the IPT. So the counselor have to know which method to use. So if this is a good choice for the client, then the counselor can use this treatment on the patient.
Assalamualaikum, my name is Nur Hafiza Asubek Ismaili. So I'll be explaining on the history of the theory. So this theory is introduced by Dr. Clement, Myrna Weissman, and their colleagues in 1969 at Yale University. So basically this study was invented while they are doing a study on whether or not an antidepressant is effective with and without the presence of psychotherapy as maintenance treatment of depression. So at that time, there are not many studies on how psychotherapy is effective for curing depression. So Dr. Clement, he started to introduce psychotherapy, and he wanted to apply it in their studies at that time. This theory is guided by three works. The first one is by Harry Sullivan. He talks about interpersonal contexts that are interrelated with psychiatric illnesses. The second one is Adolf Meyer, talks about relationship and surroundings. And the third one is Bowlby's writings about emotional bonds and distress, where people create emotional bonds and because of the fear that the bonds might be separated, so it causes depression. So this theory will be explained by my friends. So from the studies which Dr. Clement has included psychotherapy in the studies, he found out that drugs prevent relapse and psychotherapy could advance patients' social functions in society. So he was inspired as how society's influences and interpersonal distress could have a great impact on patients' triggers and relapse for depression. So, and then with these significant studies, findings, they have prescribed full treatment and introduced it as interpersonal psychotherapy. In 1984, they have published the Interpersonal Psychotherapy Manual, and from there are many studies that are conducted for other community of different ages as well as other psychiatric disorders like eating disorders and anxiety disorders. Thank you.
I'm Priyadarshini, and moving on to theoretical assumptions of interpersonal counseling. Many theoretical assumptions can be found under interpersonal counseling. One of them was the attachment theory. J. Bowlby proposed attachment theory. It is a theory of affect, self-regulation, and interpersonal relationship. Attachment theory is basically about how an individual forming a strong bond with others. For them, creating a strong bond with others is something that is essential. When an individual fails or has a problem forming a strong bond with others, they will be experiencing emotional distress. Adult attachment theory can be divided into two dimensions. They are adult attachment anxiety and adult attachment avoidance. Adult attachment anxiety is more to an individual who is stressed and nervous about their relationship. They are more likely to feel insecure and always need constant reassurance and affections from others because they will be having difficulty being alone or single. They will be relying on someone and cannot be an independent person. Eventually, this will make them insecure and drives them to emotionally desperate in their relationship. Besides, adult attachment avoidance is characterized by a fear of intimacy, excessive need for self-reliance, reluctance for self-disclosure, negative view of others, and deactivation of affect regulation strategy in which an individual tries to avoid negative feelings. Apart from that, dynamic interpersonal theory is also one of the theories that are related to interpersonal counseling. It mainly relates to the difficulties you are facing now with past events or experiences in your life. This is the theory where it reflects on a person's past events or experiences and will help adjust them in the present or future. This theory is technically encouraging you to deal with a current situation in a relationship by using our past events or experiences as a guide.
My name is Nurdin Shasha. I will proceed with the theoretical assumptions. So, in cohesive theory, George C. Human states that the higher the importance of incentives coming from a series of arguments in people's friendship, the greater the group's cohesion. Thus, this incentive theory refers to the rewards that can be either tangible or intangible, and George C. Human does not set in any limit in this concept. While for the communication theory that has been proposed by S.F. Scudder, he claimed that communication is simply a process of transmitting information from the sender to the receiver, where the receiver decodes the information and acts accordingly. This communicative principle involves two or more individuals who are in the process of forming a relationship.
My name is Kirtanasri. I will be explaining about the technique or skill used in the theory. So the first technique is identification of emotion. This technique is used to help the person to understand their feeling and from where it's come from. So for example, during a conversation, John is upset because his friend is indirectly telling that he's fat. So knowing the relevant emotion that John is hurt and not frustrated by his friend's action, Josh can address the problem. So the second technique is expression of emotion. This is a technique which help a person to reveal their feeling in the right way. So for example, William is angry and fighting with his brother. But by using this technique, William actually can express his emotion to his brother using a right way. So this will turn the situation into a cheerful ending.
So I'm Minoshni Murgaya here. So I will be explaining about the third techniques, which is dealing with emotional baggage. This technique is where people bring their past emotions and try to fit in the current situation. For an example, John grew up in a family that his parents put more attention and care for his younger brother. This caused John to feel jealous. So in current situation, John will avoid all the situation that make him feel jealous. These techniques mentioned above was not the fix. According to the article by John C. McWitz and Mirna Wismin, in the middle phase of treatment, the counselor will use specific techniques according to the patient's need.
My name is Divita, and I'll be explaining on the application of this theory to resolve clients' problems. So as Nadia mentioned before this theory is mainly applied to treat people with depression issues. And this theory, or this, to be specific, this therapy can be used in two ways. The first one is to be applied for the treatment of depression, or it also can be used to prevent the client from relapsing to the depression disorder after being cured. So this therapy usually not only applied as the therapy only, it will be usually the combination of the treatment and also medication. So usually this theory is related to depression issues, but this theory is actually modified to be used in other sorts of issues such as anxiety, dysthymia, substance abuse issues, bipolar disorder, post-traumatic stress, and many more. So this theory usually used in depression, but this theory actually can be modified in using for the issues that's happening currently. So according to a research paper used on interpersonal counseling for the modern type depression, this in Japan, where they use a case study on MTD problem, which is modern type disorder. So this MTD issue is believed to be solved or reduced with the help of the interpersonal counseling therapy. And it is found to be successful in the case study that I mentioned earlier. So from this, we can see that the application of interpersonal counseling is actually very flexible, and there are many, many other ways that we can apply it if the theory is studied further.
My name is Nur Aiman Shafika, and I'm going to talk about the criticisms. So the first positive criticism of interpersonal counseling is that it has flexible sessions. The number, frequency, as well as the duration of the sessions can be adjusted to fit with the client's needs and also their schedule. Let's say the original session is 6 sessions, and the counselor can adjust it to become 10 and lasted longer to fit the client. Next, evidence points towards the lessening of depressive symptoms. This is because, as an alternative or using it at the same time as medical treatment, interpersonal counseling offers the patients with the chance to talk and confide about their issues. So as they talk, they will get to find the cause or what triggers their depressive episodes, and at the end of the day, will solve the symptoms. The third one is it could be provided by counselors or mental health personnel of different levels of expertise. For example, psychologists, nurses, counselors, and even personnel with little background in mental health treatment can also be trained in order to conduct these counseling sessions. So as a result, patients does not have to necessarily go through long-term psychotherapy or using antidepressant drugs in order to reduce mild symptoms of depression. So especially for financially unstable patients, this is definitely a lifesaver.
Hi, madam. My name is Nur Izari Sofia binti Azhar, and I'll be explaining about negative criticism regarding this therapy. Firstly, some areas need development and further research. For example, we need to look more into the standards of clinical training for researchers and also the usage of medication in this therapy. Secondly, as we focus more on the relationship aspect, therapists might provide lack of attention towards biological and psychosocial factors of patients' lives. Lastly, just like what Shafika just said, as this therapy is very flexible, the problem can be caused by the patients themselves. For example, they might be uncooperative, they might not experience positive things, or they might bail or terminate their therapy earlier than the actual end session.
So for the conclusion, for IPT, before applying this concept, the client's or the patient's level of depression should be tested first. So that is actually a test to measure the depression of each person. So when the patient go to the hospital or the clinic, they should take the test first before the counselor do this IPT technique onto the patient. So actually the effectiveness of IPT actually entirely depends on that person and on that person himself. Is that they will be 100% cured. So it actually based on their mental health. So IPT actually has their own benefits and weaknesses, which my friend Sophia had mentioned earlier. Thank you from us, from Group 9.